Hey everyone, this is Emma, here with the latest updates about the coronavirus. A lot has happened the last couple of days, and a lot has probably happened between when I'm recording this and when you are watching it, too. I wanted to start out by drawing your attention to the fact that CNN has just decided to use the term pandemic to describe the COVID-19 outbreak. Starting today, you'll notice that in CNN's coverage, they will begin to use that word. CNN said, "It is not a decision we take lightly. While we know it sounds alarming, it should not cause panic." The World Health Organization has neglected to call coronavirus a pandemic thus far, and it actually took them a while to refer to it as an emergency. Back in January, I'd like to show you quick an article that we had on the Mind Unleashed back on January 27th, where we pointed out that the WHO has declined to call the situation a global emergency at this time. We later updated that article to say that the WHO admitted an error in assessing the risk of the coronavirus. Also on that same day, a Sunday night situation report listed the risk as very high in China, high at the regional level, and high at the global level, according to the AFP. The WHO admits that the agency incorrectly listed the global risk as moderate in reports on Thursday, Friday, and Saturday. The WHO has not been calling this what some of us have wanted the WHO to call it, and it's interesting that CNN has decided to use the term pandemic at this point. In case you're not aware, I wanted to draw your attention to the definition of pandemic. Pandemic is a disease prevalent over a whole country or the world. Obviously, this is so far prevalent in a few different countries, and we're now seeing it in many countries across the world. At the last count, I believe 109 countries have at least one case of the coronavirus at this point. So it does, to me, fit the definition of pandemic. I'm glad that CNN is now using that term. There are differing opinions on if we should be using that term and what that might mean, though. I wanted to point out an article on Mint Press News from February 26th from Whitney Webb. Is Wall Street behind the delay in declaring the coronavirus outbreak a pandemic? That's a very good question. Whitney writes about a little-known specialized bond created in 2017 by the World Bank, and that it may hold the answer as to why U.S. and global health authorities have declined to label the global spread of coronavirus a pandemic. Those bonds, now often referred to as pandemic bonds, were ostensibly intended to transfer the risk of potential pandemics in low-income nations to financial markets. Yet, in light of the growing coronavirus outbreak, the investors who purchased those products could lose millions if global health authorities were to use that label. So I would encourage you to check out this article and give that a read and see what you think about using the term pandemic. I also wanted to draw your attention to what is happening off the coast of California right now. The Grand Princess is another princess ship that is having a problem with coronavirus. It has been off the coast of California for a few days now. According to the Twitter account that belongs to Princess Cruises, they said yesterday, or I guess actually at 12:05 a.m., that they confirmed that they would be going into the port of Oakland at some point today. The ship is still not there. I've been peeking at its location all day. You can see that it's been spending a lot of time out here, just wasting time wandering around. I checked it as soon as I woke up, and it was actually all the way out here. So it's making a big loop today, but now it's pointed back over here, and we'll see if it makes it into Oakland. And if it does, a recent article in the Los Angeles Times today says that there are 2,500 passengers aboard the ship, those in need of immediate medical care or those with pre-existing medical conditions, including a woman that I saw a video interview of her who was quarantined on the ship who has stage 4 cancer and needs to get back here to Minnesota for her treatments as soon as possible. People like that will get off the ship first on Monday, followed by California residents. Before disembarking, they will have their temperatures taken and be assessed for either transfer or treatment at regional medical facilities or quarantine at state military bases. People who live out of state will be taken to federal facilities closer to their homes. Foreigners will be repatriated to their home countries according to the plan. So those are 2 things to keep an eye on today, what exactly is happening with that ship and the passengers on it, and if anybody might follow CNN and start calling this thing a pandemic. And next, I'd like to take you over to today's article on the Mind Unleashed, where we've been collecting a bunch of the important things that have happened over the past couple of days. There has been so much news about the coronavirus and the coronavirus disease. It is incredibly overwhelming, especially if you take a little bit of time off and you're not following the headlines constantly. Taking a break, you come back and you see that so much has happened in a very short amount of time. So we're trying to keep on top of these headlines so that you don't have to sit there and pay attention all day long. A huge thing that's happening today is stocks have plummeted as worries about the COVID-19 outbreak and an oil price war weighed on global financial markets. The Dow opened 1,800 points, or 7% lower. The S&P 500 dropped 6.9%, and the Nasdaq Composite dropped 7.1%. The New York Stock Exchange then halted stock trading for 15 minutes after tripping a circuit breaker. The Atlantic revealed on Friday that only 1,895 people in the United States had been tested for COVID-19 thus far. They got that information based off of interviews with medical professionals, as well as surveys of local data from across the country. That's not a lot of people. So when we look at the data about how many people have tested positive in our country, we need to remember that very few people are being tested. There are multiple people, medical professionals, that are coming forward saying that they have symptoms, they have had contact with somebody who was infected, and they are being denied the opportunity to be tested. So there's a very high likelihood that there are more people than is being reported who are positive with COVID-19. At least 21 people in the United States have died, but the lack of testing and conflicting reports regarding some recent deaths in the country are causing many people to understandably question those numbers. At TMU, we are continuing to stay on top of the latest coronavirus headlines and developments and summarizing them in articles like this, so you don't have to stay on top of things like I just explained. CPAC, APAC, and Biogen conferences were all exposed to COVID-19 recently. Two New Yorkers that attended the American-Israel Public Affairs Committee's annual conference have tested positive for COVID-19. They posted that update on their Twitter account, and they also informed attendees and participants and administration and Hill offices. That was posted to Twitter on March 6th. A Conservative Political Action Conference attendee also tested positive. U.S. President Donald Trump and U.S. Vice President Mike Pence were in attendance at CPAC, but reportedly had no contact with the infected person. That information was also posted on Twitter, and that was on March 7th. Ted Cruz confirmed on Sunday that he recently interacted with someone at CPAC who tested positive for the novel coronavirus, so he has decided to self-quarantine himself. An Arizona congressman also announced that he, along with 3 of his senior staff, are officially under self-quarantine after sustained contact with someone at CPAC who tested positive. I am announcing that I, along with 3 of my senior staff, are officially under self-quarantine after sustained contact at CPAC with a person who has since been hospitalized with the Wuhan virus. My office will be closed for the week. Meanwhile, the Massachusetts Department of Public Health announced 15 new presumptive positive cases in the state, all of which had direct connection at the Biogen conference in Boston in late February. The total number of COVID-19 cases in Massachusetts is now 28. There are states of emergency being declared in the U.S. as cases continue to explode. As we suggested last week, the New York Times is also now reporting that COVID-19 may have spread in the U.S. for weeks already. 2 cases in Washington state, detected weeks apart, had genetic links, suggesting that many more people are likely infected. On Friday, the NBA told teams to prepare for the possibility of playing games without fans in attendance. In the event it were to become necessary to play a game with only essential staff present due to the effects of the coronavirus. The entire state of New York declared a state of emergency, as cases jumped 72% in only 24 hours. At the same time, New York City has asked the Centers for Disease Control and Prevention for more COVID-19 test kits. One city official said, "Slow federal action on this matter has impeded our ability to beat back this epidemic." New York City's mayor said on Sunday, "If you are a smoker or a vapor, that does make you more vulnerable." He told New Yorkers, "If you are a smoker or a vapor, this is a very good time to stop that habit, and we will help you." Oregon's governor declared a 60-day state of emergency during a Sunday press conference. And the recorded U.S. death toll has risen to 21 as 2 deaths in Florida were announced on Friday and 2 more deaths in Washington state were announced on Sunday. In Missouri, a father took his daughter to the school dance, disobeying a quarantine and prompting her school to close. The man's family was asked to self-quarantine on Thursday after his other daughter called the county's health hotline and told them her symptoms. Washington, D.C.'s mayor announced their first positive case in a tweet on Saturday. Community spread is suspected in Arizona after the third case was discovered. The newest case is a healthcare worker who has no known confirmed contacts that are positive and no recent travel history to areas where COVID-19 is present. Community spread is likewise suspected in Chicago in what is the 7th confirmed case in the state of Illinois. Chicago Department of Public Health Commissioner said, though this may be the first case of community transmission in Chicago, it does not mean that widespread transmission of COVID-19 is happening here. Total cases have increased in multiple U.S. states over the last few days, including in Georgia, where there are now 5 cases, Massachusetts, where there are 13 cases. California has 114 cases total, and San Francisco specifically, they've increased to 8. In Iowa, there are now 3 cases. By the time you watch this video, some of those numbers may have changed, and there are also constantly new cases popping up in different U.S. states. Director of Health in San Francisco said of the new cases, these newly confirmed cases are an indication of the increasing circulation of coronavirus in the community, as expected, given the patterns in our state, region, and our own city. Of the 3 cases in Iowa Department of Health Medical Director and State Epidemiologist said all 3 individuals were part of a cruise in Egypt. IDPH is working with local public health to assess potential exposures to others. These cases are an important reminder that all Iowans need to help prevent the spread of illness by washing hands frequently, staying home when ill, and covering coughs and sneezes with a tissue. On Sunday, health officials in Contra Costa County, California announced 5 new cases, 4 of which did not travel or have known contact with a coronavirus case. In North Carolina, a hazmat decontamination tent has been put up at a hospital in Port Charlotte amid the outbreak. A supervisor at the hospital refused to confirm or deny if there is a COVID-19 patient at the facility. NASA staff has been ordered home until further notice at one of its biggest facilities after an employee tested positive. The space agency's Ames Research Center went on lockdown, and staff have been informed that it has gone into mandatory telework status effective immediately and until further notice. A new report suggests that the U.S. Congress could be suspended over fears that COVID-19 could move in on Capitol Hill. Members are very nervous, a senior Democratic leadership aide told NBC. There's a lot of concern that members could bring it home. Canada continues to confirm more cases, while Colombia and Costa Rica both confirmed first cases of COVID-19. Costa Rica's confirmed case is that of a woman from the United States who is visiting the country with her husband. In a rare bit of good news, the largest study to date coming out of Wuhan has revealed that children aged 0 to 10 years have a 67% lower odds of a severe infection compared to adults aged 20 to 40. And women appear to have an 11% lower chance of severe infection than men. Compared to adults aged 20 to 40, adults aged 40 to 60 have 44% higher odds of a severe infection, and the odds only get worse as age increases from there. Doctors in Italy are warning Europe of the devastating impact of COVID-19 and what that impact will have on hospitals. Doctors have warned medics to get ready in a letter that states that up to 10% of those infected need intensive care, resulting in overwhelmed hospitals. As of Saturday, 5,883 patients in Italy were confirmed to be infected, while 233 people had died. The Italian Society of Anesthesia, Analgesia, Resuscitation, and Intensive Care said in a document titled Recommendations of Clinical Ethics for Admission to Intensive Treatments and for Their Suspension in Exceptional Conditions of Imbalance Between Needs and Available Resources, that it may be necessary to place an age limit on entry into intensive care, and that it's not a question of making merely valuable choices, but of reserving resources that could be very scarce. They also discuss probability of survival and people who have more years of life that would be saved, with a view of maximizing the benefits for the greatest number of people. The World Health Organization continues to urge countries to follow China's drastic containment measures. Allowing uncontrolled spread should not be a choice of any government, as it will harm not only the citizens of that country, but affect other countries as well. And again, the United States is behind the curve in terms of containment measures compared to countries that are experiencing large outbreaks like China and Italy. A grim analysis suggests that all hospital beds in the United States will be filled by May 8th in what is expected to be a complete overwhelming of the U.S. healthcare system. Again, If all hospitals, especially the intensive care units, become overwhelmed by patients that are experiencing the effects of COVID-19, there is going to be an inability to treat the regular cases that come into the hospital normally, whether that's somebody who has an allergic reaction, a heart attack, appendicitis, they are having a baby, they need cancer treatment. All of these things are going to be harder to access if the hospitals are completely overwhelmed by coronavirus patients. There's also the risk that these other people who are coming in for the regular things could then contract coronavirus if they're in a hospital. National Nurses United recently released survey results indicating that the U.S. is wildly unprepared for the coronavirus. Only 44% of those polled, out of 6,500 nurses, reported having been provided any information on how to recognize and respond to possible cases of coronavirus by their employer. That is shocking. An unnamed nurse explained, "As a nurse, I'm very concerned that not enough is being done to stop the spread of the coronavirus. I know because I am currently sick and in quarantine after caring for a patient who tested positive. I'm waiting for permission from the federal government to allow for my testing, even after my physician and county health professional ordered it. That is completely unacceptable, and that is not an isolated case, unfortunately." TMU has been in contact with a nurse in Michigan who claims that patients with clear signs of COVID-19 are being refused testing and simply sent home. That nurse has since been alerted that they had been exposed to somebody with the virus. Despite there not being any confirmed cases in the state or the area, that nurse is also being denied a test as well and is quarantined. A leaked presentation reveals that U.S. hospitals are preparing for millions of hospitalizations due to the outbreak. The February 26th presentation, titled "What Healthcare Leaders Need to Know Preparing for the COVID-19, included representatives from the National Ebola Training and Education Center and suggested there may be up to 96 million cases in the United States, 4.8 million hospitalizations, and 480,000 deaths. 72 million people are quarantined in Italy and China, which is completely unprecedented and shocking and not something that has happened before, and something that people, if they're not already, really need to pay attention to. On Thursday, a residential street in Rocklin, California was placed under quarantine after a resident with COVID-19 died. Law enforcement partners are currently responding to enforce a health officer's order. "We cannot share any additional information to protect patient confidentiality," the Placer County health spokesperson said at the time. According to WIBW, the orders were given under sections of California Health and Safety Code that allows Placer Health to enforce regulations requiring strict isolation or quarantine if the action is necessary for the protection of the public health. This is something that people definitely need to pay attention to as states of emergency and various things like that are declared in cities and states across the country. What does that mean that they can do? What does the health and safety code around where you live allow the health department or allow the government or allow the police to do in a situation like this? Rockland police were unable to answer questions from TMU or provide an update as to whether that quarantine was still taking place. Instead, they are referring all of their inquiries directly to Placer County, who we have not been able to connect with yet. Italy has announced a massive quarantine of the entire region of Lombardy until April 3rd. Also in Italy, one of the most powerful politicians, a Democratic Party leader, tested positive for the virus. The massive quarantine provoked panic and triggered stock markets to plunge by 11%. Italians who attempt to flee the quarantine may face 3 months in prison, Italy's interior minister has warned. Now, that is interesting, especially considering the fact that Iran released prisoners recently due to the outbreak because they did not want it to spread within the prison. So at a time when we are trying to keep people separated, encourage them to self-quarantine, is it a good idea to have people facing prison time at a time like this? If that does occur, are they going to be imprisoned immediately and quickly spread something if they are sick among the other prisoners? We know from the ships, the cruise ships, that confined places like that, it seems to spread easily and quickly. I have no doubt that something like that would happen in a prison. The Italian military airlifted a coronavirus patient between hospitals on Saturday using a special biocontainment unit to reduce the risk of infecting other people. We've got the video embedded in here from RT, and that is definitely worth taking a look at. This clearly looks like something out of a movie, not something that I've ever seen before happen in real life. The eerie green lighting certainly doesn't help. I can't imagine what it was like to be inside of that containment unit being airlifted. The things that we are experiencing right now are just completely unprecedented. In France, the government has banned gatherings of more than 1,000 people nationwide. The priority is to do all we can to slow the transmission of the virus. The British government announced on Monday that it had set up a team to tackle interference and disinformation around the COVID-19 outbreak. The counter-disinformation team will try to establish the impact of false information aimed at misleading people, either for the purpose of causing harm or for political, personal, or financial gain. The team will then aim to identify and respond to disinformation. Now, I do not like censorship. This sounds scary to me. I understand, though, that you would not want disinformation spreading if the point is that it is purposeful disinformation. But this is a huge slippery slope, because who are the people who decide what is disinformation and what is not? Who decides what is the truth and what is not? Who decides what is okay for people to know about this and what is not? I'm a firm believer in putting all of the information out there, even if it is somebody spreading something for personal or financial gain or something that is completely false, and people being able to consume all of that and figure out what's true or not for themselves instead of having somebody else hide everything from them, because it is a super slippery slope and it is very scary. The Philippines declared a health emergency on Monday amid the growing anxiety that COVID-19 is already spreading undetected. In Saudi Arabia, images of security forces quarantining the Qatif province and restricting traffic have been showing up on social media. The office of Portugal's 71-year-old president announced on Sunday that President Marcelo Rebelo de Sousa has canceled all public activities and will self-quarantine at home amid the COVID-19 outbreak. His office said that the president had no symptoms. Japan is set to alter a law this week allowing the prime minister to declare a state of emergency over the COVID-19 outbreak if needed. His critics have called out his initial lack of leadership on the issue. And in China, a hotel being used to house people in quarantine collapsed. At least 10 people were killed and others still remain missing. An infectious disease expert at the forefront of the search for a coronavirus vaccine on Friday said that it was the most frightening disease he's ever encountered, and that war is an appropriate analogy for what the US is facing, as 50 to 70% of the global population may become infected. Now, I know a lot of people are concerned about a vaccine coming on the market for something like this. There are some people that think that this whole thing was orchestrated in order to enact mass mandatory vaccination. I don't think it's worth arguing those details at the moment, but I do think it's worth paying attention to a new vaccine being on the market for this. We know that something like this would prompt the development of a vaccine. That's not unusual, that's not shocking, that's not strange, but there are things to be concerned about new vaccines that are created and fast-tracked and didn't go through appropriate testing. If a vaccine does come on the market, is that something that's going to be pushed as mandatory? We have seen a battle the last couple of years all across the country for mandatory vaccination. People who are absolutely against mandatory vaccination, even if they're actually okay with vaccines. The fact that it's mandatory is the piece that is most concerning to a lot of people. That might be something that we see come as an effect of this pandemic, and that is something to definitely keep our eyes on. Again, please continue to check The Mind Unleashed for important updates, and please follow along with the very latest news on our Telegram channel. If you're on Telegram, you can follow it right here at right here at COVID-19 report. If you are not on Telegram, you can just see this feed. If you open this up in your browser, go to t.me/s/COVID-19 UK/COVID-19 report and just keep this open in a tab and refresh it all day long for some of the latest breaking news. I'll look and see what has happened since I've been recording this video. US hospitals need to more than double the number of available beds in best case scenario for the COVID-19 update, says an article from The Independent. Moscow goes on high alert, threatening 5 years in jail for people who break self-quarantine. The death toll in Iran surges to 237 as medical staff are unable to get safety equipment. That is something to keep in mind for countries like Iran and others that are under sanctions from the US. Sanctions from the US often impact the ability for countries to provide medications and medical supplies and things like that. Our government communicates to us that sanctions are meant to put pressure on the government and the elite and the people in charge of those countries, when in fact it always impacts the people. These countries are really going to feel that if they have outbreaks, and it looks like that is definitely what Iran is experiencing, unfortunately. The head of New York and New Jersey Port Authority has tested positive and is now being quarantined. And Ireland has cancelled their St. Patrick's Day parade over fears of COVID-19. So again, please keep this Telegram channel open in your in a tab. If you are on Telegram, please follow it and share these things. You can just click on them and you can share them to other people that are on Telegram if you'd like, but we've got all the information in each of these along with the link back to the article that it came from if you would like to share that as well. Again, remember to come back to The Mind Unleashed and keep an eye out for our latest COVID-19 articles. If you want to look back at some of the past ones, you can just click here on my name, and all of the recent things that I've done have been articles just like this because they are very time consuming. I do not really have time to research and write about other things. So again, as always, thank you so much for tuning in and watching this video. Please share it. Please share that article. And if you see anything that you think I need to know about, please alert me, send me a message wherever you might follow me. I would really appreciate it. And please prepare yourself. If you haven't yet, sit down with the people that live in your house, get a piece of paper, come up with a plan. What kind of stuff do you need in the event that we do end up quarantined for 2 weeks, a month, 2 months? It's time to start considering this. It does not mean that you're panicking. Now is not the time to make fun of people who are buying extra things. Now is the time to just prepare yourself. It will save you, hopefully, from panicking later. If this fizzles out and you didn't need to prepare, then oh well. You prepared and you're still going to use this stuff, and it's good for us to have emergency plans in our households anyway. Stay safe and please prepare.